Insurance case management is one of the most misunderstood nursing roles beyond the bedside. And one of the biggest misconceptions is that insurance case managers are only there to deny care. That is not the full picture. Insurance case management is about looking at a patient's needs, their benefits, their care plan, and the resources available to help them move through the healthcare system in a more coordinated way. Because insurance case management is still nursing, but it uses your nursing judgment in a very different environment. At the bedside, you are usually focused on what is happening right now, the patient's condition, their medications, their symptoms, their safety, and what needs to happen during that shift. In insurance case management, the focus is often broader. You may be looking at what services the patient needs over time, what level of care is appropriate, what benefits are available, and what barriers could prevent the patient from following the plan. The setting is different, but the core questions are still familiar. What does this patient need? Is the current plan safe and appropriate? Are there gaps in care? Does the patient understand what to do next? And what resources could help prevent avoidable complications or readmissions? That is where nursing experience matters. An insurance case manager may work with members who have chronic conditions, recent hospitalizations, complex medication needs, high-risk pregnancies, behavioral health needs, or multiple providers involved in their care. Depending on the role, you may be calling patients directly, reviewing care plans, coordinating services, helping with transitions of care, identifying barriers, educating members, or communicating with providers and internal teams. Some insurance roles are more focused on case management. Others may include utilization review, prior authorization, or medical necessity review. That distinction matters. Case management is usually more focused on coordination, support, education, and helping the member navigate the system. Utilization review is more focused on whether a requested service, admission, or level of care meets certain criteria. There can be overlap, but they are not always the same job. So when you are looking at insurance nursing jobs, do not just read the title. Read the responsibilities carefully. Look for words like care coordination, disease management, transitions of care, member outreach, utilization management, prior authorization, discharge follow-up, benefits, medical necessity, and provider communication. Those words tell you what the job will likely feel like day to day. For example, if the job description talks a lot about member outreach, education, and care planning, it may be more of a telephonic case management role. If it talks more about reviewing requests, applying criteria, authorizations, and medical necessity, it may lean more toward utilization review or utilization management. Neither is automatically better. They are just different. A nurse who enjoys patient education, motivational conversations, and helping people understand their care may prefer a case management-heavy role. A nurse who enjoys chart review, clinical reasoning, guidelines, documentation, and less direct patient contact may be more comfortable in utilization review. This is why knowing yourself matters before applying. Insurance case management can be a great fit for nurses who are organized, comfortable on the phone, good at documentation, and able to explain healthcare information clearly without using too much jargon. It can also be a good fit for nurses who like problem solving, but do not necessarily want the physical demands of bedside care. But it is important to be realistic. Remote or non-bedside does not always mean easy. Insurance case managers may have productivity expectations, call requirements, documentation standards, software systems to learn, and policies that guide what can and cannot be approved or arranged. You may also speak with patients who are frustrated, confused, overwhelmed, or upset because they do not understand their benefits or they feel like the system is working against them. That takes patience. It also takes strong communication skills because you may have to explain what you can help with, what you cannot change, and what the next step is without making the person feel dismissed. This is where bedside experience can help more than nurses realize. If you have ever explained discharge instructions to a patient who was overwhelmed, called a provider for clarification, helped a family understand the plan, or notice that a patient did not have what they needed to be safe after discharge, you have already used skills that matter in insurance case management. You have learned how to listen for what is not being said. You have learned how to recognize when a plan looks good on paper, but may not work in real life. And you have learned how to advocate while still working within a system that has rules, timelines, and limitations. That is a major part of insurance case management. You are often helping patients understand the system while also working inside the system. Now, before applying, there are a few things nurses should pay close attention to. First, look at whether the role is truly case management or more utilization review. The title may say case manager, but the duties may be mostly authorization reviews. Second, look at how much patient contact is involved. Some nurses love telephonic outreach. Others find back-to-back calls draining. Third, look at the population you would be serving. Managing care for complex adult patients may feel very different from maternal health, pediatrics, behavioral health, workers' compensation, or Medicare Advantage populations. Fourth, pay attention to training. If you are new to insurance case management, you want to know how much support is offered as you learn the systems, documentation requirements, and payer language. And finally, pay attention to how the role measures success. Is it based on calls completed, care plans updated, authorizations reviewed, member engagement, quality measures, or something else? Those details can tell you a lot about the pace and pressure of the job. If you are trying to move from bedside nursing into insurance case management, one of the best things you can do is start translating your experience into payer-side language. Instead of only saying, "I provided patient care," you might say, "I coordinated care with interdisciplinary teams, identified discharge barriers, educated patients and families, monitored changes in condition, and supported safe transitions of care." That language connects your bedside experience to case management. You can also start learning terms like medical necessity, authorization, benefits, level of care, transitions of care, care plan, member outreach, and utilization management. You do not need to know everything before you apply, but understanding the language can help you read job postings more clearly and speak more confidently in interviews. The biggest takeaway is this: insurance case management is not bedside nursing from a computer. It is a different type of nursing role with a different workflow, different pressures, and a different way of helping patients. For the right nurse, it can be a meaningful path beyond the bedside, especially if you enjoy education, coordination, documentation, problem solving, and helping patients navigate a complicated healthcare system. But before you apply, take time to understand what kind of insurance role you are looking at. Case management, utilization review, prior authorization, and care coordination can overlap, but they are not always the same experience. The more clearly you understand the role, the better you can decide if it fits your strengths, your goals, and the type of nursing career you want to build next. And if case management is the path you are curious about, we have a place for you to start. To better understand case management beyond the bedside, click the link below and visit the CMI landing page. You can start learning what case management is, how the role works, and how your nursing experience can translate into this next chapter of your career. Because your nursing career does not have to end at the bedside. It can grow from there, and if you're ready to explore the different paths inside case management, choose one of the videos on screen now.